Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our chronic pain series. And I know, this is the holidays, so mental health is certain very important, and particularly during the holidays. I have Emily Rich here with me today. She is going to be speaking about mental health and persistent pain. Emily is a occupational therapist with our TMC Adult Therapies. And so I'm so happy that you're here today, Emily, to really share about this topic because I think it is so important for everyone to know and maybe have some tools that they can use as well. So welcome.
Thank you, Maya. Yeah, absolutely. We've got lots of tools in here today. So thanks for joining us, those of you in person and also those of you online. As Maya mentioned, we'll be talking about the psychosocial, or what sometimes we just call mental health aspects of persistent pain. So just sort of a brief outline for today, we're going to talk about the neuroscience of pain and mental health. How do those things relate? What's the science that we understand behind those? And then strategies and intervention options. So sort of creating a toolbox for you, hopefully walking away with at least a few new things that you haven't done before. If we have time, we'll try a brief practice, and then we'll have plenty of time for a question and answer, both online and in person. And so feel free to put your questions in the chat box if you are watching from home today, and we will get to those at the end. All right, so what is psychosocial? So sometimes we talk about the psychological and the social implications of pain, and we call that psychosocial. And then we add in biopsychosocial as biological, psychological, and the social implications. So how do these things really influence our pain when it comes to the psychology, that what goes on in our minds? Well, from the research, we know that emotions, attention, thoughts, and stress all affect the brain pathways that facilitate pain. Sometimes something called cognitive emotional sensitization may occur, where excessive worry or ruminating over something, kind of thinking obsessively about something, that actually can lead to sensations that manifest in our physical bodies. And we believe that persistent pain actually has the potential to change the circuitry in our brain, including the areas that can regulate pain levels. And therefore, if we've had pain for longer, like someone with what we often call chronic pain, we need to work even harder to relieve that sensation. And then finally, relatively negative factors such as a lack of financial means or a lack of support may lead to a decreased ability to stop pain signals and lead to increased pain. So what we see here, this visual sort of showing what we sometimes talk about top-down disinhibition of pain or facilitation of pain. So how our minds have the power to potentially stop pain signals from being as strong or strengthen those pain signals, as we see with stress and with different sort of challenging emotions that we might experience. So hopefully you can appreciate how this is a bi-directional relationship when it comes to our mental health and our chronic pain. Worse pain leads to worsening mental health, and psychosocial challenges can lead to an increase in our pain perception, the way that we perceive pain signals. I want to say here that this is completely normal. When there's alarm signals going off in our bodies from pain, it makes sense to respond in fear or worry. That's a very natural thing that we would do. But unfortunately, there comes a point when that alarm signal no longer serves us after that initial injury has subsided and we're left with often persisting or chronic pain. If this is your first lecture you've attended in this series, I would definitely go back after this and watch the overview of the chronic pain, kind of the science of pain, to better understand how these things relate. So on that note, when we respond in fear from a pain signal, it can result in a fear avoidance pattern. Let's say that you experience fear associated with a situation that harmed you in the past, maybe getting in a car after getting in a car accident, for example. So when we get in the car, we may experience fear that then results in us feeling physical pain in our bodies. And over time, this can become sort of this chronic pain state in our bodies, even though we might not even be aware of that fear, but our brain makes that association. Similarly, other negative self statements or negative, what we call negative cognitions, we might say things like, I'm never going to feel like myself again, or this pain is never going to get better. And these might actually be avoidance coping strategies. They limit our need to process the emotions in our body, and those can amplify our pain if those signals get pretty big. And so those can make us live in more of sort of that fight or flight state. So these aren't necessarily going to happen in this order. These are all interrelated concepts, as are depression, anxiety, substance use disorders, and histories of trauma and sexual violence, which we know that these things are not uncommon in people who experience chronic pain. It's not the case with everyone that has chronic pain by any means, but it sort of helps to illustrate even further the relationship that we see. Here's a little more about what I was saying with the negative self-statements that we might find ourselves saying, that they can help us to try and avoid having to deal with what's going on in our bodies, but it can actually heighten the experience of pain. So you can see sort of at the bottom here, so this can lead to what we call catastrophizing or anticipating the worst possible outcome, right? This is never going to get better. I'm never going to stop feeling this pain. And then that leads to more attention on the pain, which can lead to avoiding activities and avoiding movements. And so what's challenging about that is then we might start doing less activities, doing less things, and that can have downstream effects. We'll talk about those in a little bit. Here's a visual of what this might look like, where pain may cause and may be intensified by our thoughts, our emotional responses, our activity or our avoidance of activities, and then subsequent functional limitations, and then deconditioning. So over time, if we do less because we're fearful that it's going to cause pain, often that leads to deconditioning or lessening of our muscle strength, lessening of our cardiovascular tolerance. And that's really the opposite direction that we would prefer, that we would want people to go in terms of physical activity does typically help with managing pain. Here's another visual showing on the left side how this is a common but not as productive coping strategy. So it's very normal, especially in early pain. But the goal is that we can shift over into this right side where we recognize that pain is a warning sign. And we confront the fear and the pain, and we work toward recovery at the top there. And part of this includes helping the body to know that it is safe. And so that's where our nervous system comes into play, which we're going to touch on in just a minute. This shows a model of how we assess the psychosocial elements of chronic pain to better understand the big picture of a person's life and the various influences on our life. So this includes the type of pain, the big picture body factors, such as using or discontinuing the use of a body part. That's that S, somatic and medical factors. Exercise capacity and compensatory patterns and more there. So if someone has back pain, they might start compensating by moving in a different way, which can lead to pain in other parts of the body and disuse of that part of our body. We also look at the thoughts and beliefs that people have about their pain. So that's that cognition, perceptions, the emotional factors and the behavioral factors, such as avoiding activity or persistence when someone pushes through too hard, and eventually they might begin to what we call yo-yo, between extremes of overactivity, ignoring pain, pushing through, just getting through, and then eventually underactivity because they're feeling that sort of chronic pain flare that comes afterwards. They've overdone it, and now they have trouble getting off the couch or getting out of bed. We call those yo-yoing between too much and too little. Other factors include the social environment where you live, your partners and family, and any prior treatments that you've had, both successful and unsuccessful treatments. Those stick with us. Finally, and maybe most importantly, is a person's motivation for change. Persistent pain management is a process, and everyone is allowed to go at the pace that they are ready for and need. Some people aren't ready for rehabilitation, for example, or implementing treatment into their life, but maybe they will be in 6 months or a year. And so really making sure that the treatment that you're seeking is matching where you're at in your recovery. So to be clear, all of this does not mean that pain is all in your head and not based on brain and body functioning. It does not imply that it is simple, straightforward, or easy to change. If that was the case, we would definitely not have the epidemic that we're experiencing of chronic pain in our country. But it does mean that there are some factors that are more within our control than others. In my personal and professional experience, I want you to have as many of those self-empowering tools as possible. All right, so let's go a bit into the specific brain science here. So most of us are familiar with the phrase fight or flight, maybe rest and digest. It comes from your autonomic nervous system. This is the system that regulates our subconscious ability to do all of these things in various organ systems. Things like changing our pupil size, salivating, regulating your heart rate, breathing, digestion. So if we're more in that fight or flight state, again, you might not realize if your body is in this state, or if you spend the majority of your time here, because it sort of becomes our norm when we live in pain. This is true for a lot of people. So you might not say, I feel fearful right now, but your body might not truly feel at rest or feel comfortable in different environments. And you'll see here that it's much harder for the body to self-regulate if we can't let our guard down and digest our food appropriately so that we can get all of our nutrients from it, regulate the circulation of blood. So people who have cold hands or clammy hands and feet often means that they're more in this state of fight or flight. That's sort of a signal to you. If others aren't cold, it's not a cold environment, that you might be more in that nervous system state. And also controlling our breathing. So when our body releases adrenaline, over the long run, this can result in what we see on this left side here. So blurred vision, eye tics, or feeling fatigued in your eyes. In this state, you might have dry mouth. We're not secreting the same fluid from our salivary glands. Same with our eyes. We're not secreting that fluid from our tear ducts. You might have a difficulty swallowing or tension in your jaw. You might feel dizzy, jittery, pain in your diaphragm if you're breathing rapidly but not performing any physical activity that might be causing that. Because there's excess oxygen in your system when we breathe in that way. We breathe more shallow, more chest breathing. So therefore, pain can cause the autonomic nervous system to be more in a state of stress, which can subsequently cause more pain for many different reasons. One of which being digestion is sort of an easy example, that brain-gut connection. So if someone is not digesting their food well, they're more likely to have abdominal or gastrointestinal pains. Signs of stress may include shallow breathing, depression, tight muscles, anxiety, poor sleep. And so as you might guess, relaxation is very important for coping with pain, because pain is not only stressful in itself, But stress exacerbates or worsens and also maintains our pain. Relaxation can be helpful in calming your nervous system, which often becomes sensitized, or it's easier for that nervous system to feel the stress when pain persists for a long time. Relaxation also boosts your body's natural pain regulators, such as endorphins, which we sometimes call feel-good hormones. Relaxation is different from mindfulness. Mindfulness is an awareness through intentionally paying attention in the present moment. But here's the key: doing so non-judgmentally. So we want to separate the subjective or our personal experience from the factual or objective evidence. Negative thoughts drive negative feelings, which can sensitize our nervous system and increase our pain levels. So thinking really negatively about pain, or what some might call pain catastrophizing, making really big statements like, I will never feel better, this is never going to go away. That's one of the strongest predictors that short-term acute pain, less than 3 months long, will actually become long-term persistent pain. So that is something that early on we really want to try and help people to kind of get through those acute pains with forward thinking that things will get better and positive thoughts. But in this case, so rather than this man saying pain is bad, I need to get rid of it, he's able to reframe to be curious. What does this sensation feel like in my body? Without judging whether it's a good or bad sensation, and trying not to develop a significant adverse emotional response to it. So if we can create this awareness of the sensation without judging it, this is hard, I recognize. This is not what our bodies typically would do normally. Then we can experience less anxiety and depression and not feel a need to fix it or to reduce our perception of pain, tension, and stress. So if we take that feeling like we have to fix it and we just observe it non-judgmentally, that using that curiosity can be helpful. So that is mindfulness in a nutshell. And I'm not just saying this because mindfulness is all the rage right now. The science actually shows us that the brain changes with mindfulness and also with meditation. So we see more brain activity in processing sensory information and less in the regions associated with emotions in people who meditate. I'll say that again. More brain activity in processing sensory information in people who meditate, and less in the regions associated with our emotions. So more kind of like the factual pieces. We also see decreased pain intensity in people who meditate compared to a placebo intervention, with less activity in the part of the brain where we believe evaluates sensory information. So these are studies showing the brain changes that we see with mindfulness and with meditation. We also see improvements in depression levels and quality of life. And mindful meditation teaches your brain to experience pain with less distress. Again, focusing on the factual information, trying to be curious about a sensation, less attached to the emotional response to that sensation. Specifically, we see changes in sustained attention, our ability to focus on something, in the area of the brain that detects mind wandering, the ability to switch our attention from one thing to another, and the ability to redirect our attention to something that you choose. So we can appreciate how when pain happens, it's pretty hard sometimes to redirect our attention to something else. That pain signal is strong. And so what we find is that mindfulness helps us to be able to choose to focus on something else. These people have more gray matter in their brain, which helps with processing and emotional control. And finally, we see stress reduction overall in mindful meditators. So what if you're not a master meditator? This is not a class on meditation. Fortunately, there are so many other things that you can do as well. But hopefully that piqued your interest, your curiosity about mindfulness in general. And so we're going to just go through some things that have to do with mindfulness, some things that are totally unrelated, but strategies that might be able to help you with managing pain. All right, so what can help? First, I often like to start with this concept from dialectical behavior therapy. And it's this idea of a rational or a logical mind and the wise mind, which is somewhere in between our rational mind and our emotional mind. When we're sort of at our best, we're using logic as well as emotion, and we're not carrying either of those too heavily. That's where we find our wise mind. So the rational mind uses reasoning and fact to approach a situation from an intellectual perspective, but not necessarily considering the emotional piece. While the emotional mind uses emotion-driven thinking to make decisions, it can be reactive, and it has more difficulty accessing logic or fact. So that wise mind, we see the balance of emotional and rational minds, and this is living from a mindful awareness, taking emotions and logic into account without overemphasizing either. In terms of the different types of psychological modalities, I see a lot of people who experience persistent pain. And often I think that psychotherapy doesn't feel approachable. Feels like someone's going to tell them this is all in your head, or not address what they're feeling physical pain-wise. So I think that sometimes it's helpful just to know what is out there, what is the psychological approach to chronic pain. And hopefully we're not ever emphasizing one thing too heavily over the others, but taking all things into account. So cognitive behavioral therapy is a well-known approach to treating challenging thoughts, where we consider our thoughts, our emotions, and our behaviors. It gets some criticism, especially more recently, so maybe more now than ever. And it's not the right approach for everyone. So I think it's really good to know that there are other approaches as well. And sometimes we call these third wave therapies. So from cognitive behavioral therapy, just as any other good solid foundation of anything, we are seeing new things form out of cognitive behavioral therapy. And these are not brand new by any means, but less familiar to most people. So there's dialectical behavior therapy, or DBT, acceptance and commitment therapy, or ACT, and mindfulness-based cognitive therapy, MBCT. These are more about the process, the context, and the function of how a person relates to their internal experience. Concepts such as metacognition, or thinking about your thinking. So stepping outside of your own emotional experience and thinking about what's going on. Acceptance, mindfulness, personal values, and spirituality are frequently incorporated into what otherwise might be considered a traditional behavioral intervention. So we'll go through these very briefly now, just so you have some sense of what these are. Dialectical behavior therapy is especially focused on when we feel strong emotions, helping us to understand and accept those feelings. One concept is called defusing from sticky thoughts or emotions that sometimes are hard to get out of our heads. So when you keep feeling something and it's really hard to detach from it or to defuse from it. This shows how you might take a thought like, I'm stupid, and notice that thought, followed by noticing that you're noticing the thought. This is termed metacognition, or thinking about our thinking. And we can hold our thoughts lightly and recognize that they are just thoughts. This concept is similar to clouds in the sky, where you might imagine a windy sky, where you can see all of the clouds passing by and trying to notice those thoughts without judging or analyzing them, and just imagine that your thoughts are written on the clouds. One thought for every cloud. You can summarize your thought with one or a couple of words. So this is something you might try at home or when you're finding yourself getting stuck in a thought cycle. And then what you want to do is imagine how the windy sky helps to make those clouds just move on through. Sometimes people describe it as a car on the road, and that car continues to move forward so that it doesn't get stuck or stay where we are. That wind or that gas moves the car through, moves the cloud on. Keep being aware of the thoughts that are in your mind and continue imagining every other thought on a cloud that's floating through the sky. So those are just a couple examples of diffusion. The next approach is acceptance and commitment therapy, or ACT. This might be, if I'm a little bit biased, but this might be my favorite approach for persistent pain. The main difference between ACT and DBT, the one we just talked about, would be that DBT leans more toward an educative approach, teaching, and ACT emphasizes a little more of an experiential approach where you're actually experiencing it. This may help you decide what type of therapy you want to try based on if you lean more towards educational approaches or you think you need to experience something to learn it. It's different from traditional cognitive behavioral therapy, as instead of trying to change negative or destructive thoughts, ACT recognizes that pain and discomfort are part of life. And so we must try to accept our thoughts rather than to change our thoughts, and work to get comfortable with these if we wish to live a happy life. It includes modalities like mindfulness, understanding your values, using exercises and metaphors to learn how to change our relationship with various experiences and thoughts. And so here's just a sort of a big picture overview for when you go home and you kind of think, what would I maybe fall in line with more? One resource for finding a therapist is contextualscience.org. You can find folks that are trained in ACT. Psychological flexibility is a goal to help decrease perseveration or getting stuck on certain thoughts. We can start to see thoughts as just mental events rather than facts, which lessens their impact. In other words, we don't as easily buy into the negative story around our pain. And this is especially important in overcoming upsetting emotional impacts of pain and disability, such as depression and anxiety. And so here's a few other examples of ACT activities. Again, that diffusing from sticky thoughts is still incorporated in ACT. Connecting to a sense of self as experiencer, mindfulness, again, those values, clarification, what is important to you, what do you value in your life, and making and keeping commitments. The third one that I mentioned of the third wave therapies is mindfulness-based stress reduction, which is a very heavily researched intervention for the general population. There's a lot of studies on this, and it uses mindfulness to teach healthy responses to stress. The aim is to decrease avoidance patterns or trying to avoid something, step around it. You might have noticed the Robert Frost quote on the last slide, the only way out is through. So trying to decrease unhelpful coping skills, but instead develop skills to know what to do when stressors arise. As I mentioned, there's a lot of studies with positive outcomes in persistent pain specifically as well, with increases in physical function, vitality, anxiety levels improve in depression, acceptance of their condition, improvement in pain levels in both the short and the long term. The good thing about MBSR is you can easily find classes online. There's group classes, that you can take at home in the comfort of your home if you're not sure about going to a group class in person, or if you're not sure about going to a therapist. So this is something that's very, very accessible to basically everyone. They're relatively affordable too. Self-compassion is probably my favorite approach for self-regulation, or trying to manage your feelings and your thoughts and your actions in the moment from a psychological perspective. It's gentle, it's validating, and it has significant research evidence for all kinds of health parameters. We know that if we have a persistent health condition or different symptoms, even without a name for them, and subsequently we have a change in our function, it's very understandable. And I actually would argue that I would expect someone to have an emotional response to that. When it feels like your whole life changes, your day-to-day is very different, I would hope that someone would have an emotional response to that, right? And so self-compassion has 3 elements: mindfulness, or being aware of the present moment, as we've discussed; common humanity, or normalizing your experience as a part of that shared human experience. So the idea that everyone suffers in some way. Everyone else might not suffer in exactly the same way as you, but sort of this idea of not feeling isolated, not feeling like the only one. And then self-kindness, where you work to comfort yourself. There's actually quite a few free resources here that are listed, or maybe on the next. But Kristen Neff is a really helpful researcher in this area. She has several books and also free resources on her website. And the idea of you can create sort of a mantra for yourself using these 3 components: mindfulness, common humanity, and self-compassion. So that might look like, this is really hard right now. So that would be mindfulness, recognizing this is hard right now, I'm in pain, whatever it is, this is hard. Struggling is a part of life. That's that common humanity. And then, may I be kind to myself, and that's showing that self-kindness. So sometimes having a mantra like that to access in the moment can be helpful. On this next slide, here's some resources. So there's a free self-assessment that you can take online to say, where am I at with this? Do I have self-compassion, or am I pretty critical of myself, and is this a challenging thing for me? So that's sort of a good foundation to start with. And then there's lots of guided practices that there's audio for them on Kristen Neff's website. And then there's also exercises that can be sort of like written practices. For example, thinking about how would you treat a friend, right? If a friend was in the same exact situation, trying to really step outside yourself and get perspective. Self-compassion writing, journaling, using supportive touch for yourself, which we know can help to release some of those hormones. That can be helpful. Taking a self-compassion break, lots of really great practices. And then, as I mentioned, she has some books. So she has a few just regular books, and on the far left, you'll see a workbook here, which is excellent. So again, if you're someone who feels like you're not ready to go see a therapist, I would still highly encourage trying, but the workbook is fantastic in terms of doing some things at home for yourself. It really is, the more that you work on this self-compassion muscle, the easier it becomes, and the more reflexive you are toward doing that versus that criticism that we often fall into. All right, more resources and ways to address this. So biofeedback just means feedback about the body, and that can be helpful in terms of learning how to self-regulate and understanding our body's responses to different things. We often don't even recognize that if someone raises their voice, or if we're playing an intense game, or how different scenarios that might be perceived as lighthearted or not a big deal, our nervous systems often perceive those as a threat. So for example, you'll see here on the bottom right, heart rate variability, where we measure your depth and the length of each of your breaths. And you can see on that far right side, that image and the breathing pattern of someone who is frustrated versus someone who's experiencing appreciation. So we know that our breathing changes in response to our emotions. That's just fact. And so how breath can help to facilitate or inhibit pain. We also measure hand and foot temperature, that peripheral body temperature. And we can also look at muscle activity, for example, if your shoulders or your neck are tense. And just tune into those signals so that we can start to learn that about ourselves. The goal is ultimately independence in self-regulating without the need for these devices. It's not that you're going to walk around with things connected all the time, but it's to learn about yourself and then to start to try and implement those things into daily life. You might also look on your phone. There's a couple of apps here. Juva Health is a free, excellent app that was created, I believe, by a neurologist, specific to people with migraine, but it's really helpful for people with lots of conditions. And it's a form of biofeedback. And then there's a paid app called Tori, as well as lots of different resources out there. There's something called the Leaf, lots of different things that you can do on your own at home, relatively affordably. On that note, there are other ways that we can help to regulate the autonomic nervous system and to decrease our heart rate and inflammation overall in our body while increasing digestion, improving our sleep, and our circulation. So breathwork is just one strategy, as is relaxation in general, to activate that parasympathetic or that rest and digest response. There's specific exercises that help with toning our vagus nerve. Our vagus nerve is what helps to activate that rest and digest response. So even simple things like humming, singing, splashing cold water on yourself or your face, and different massages and laughing techniques. So you can look more into that if that's something of interest to you. And then trying to help the nervous system when it does become overstimulated. So the whole goal of the vagus nerve work and the relaxation work is to help your body to be able to switch back into that parasympathetic or rest and digest, because we can't control the world. We know that things happen, that there's loud noises, people come around the corner and scare us, and we almost get in a car accident. Like, the world is just the way that it is. So one is trying to help yourself to more quickly shift into that parasympathetic response. And the other is to compensate with things like using weighted items. So likely everyone now has heard of weighted blankets. This is not a new thing. It's just newly accessible to the general public, but occupational therapists have been using them for years. And I personally really like weighted lap pads as an option versus an entire weighted blanket. If you don't like the blanket. So just thinking about even putting like a backpack on your lap that has some heavy items inside, or putting books on your lap, anything that will help to give your nervous system input and feedback. It's basically helping to ground you when your body feels sort of like all over the place, or it's difficult to help regulate. The weighted items are helping to do that. As well as compression, you'll see on the bottom right picture, that's a compression sheet. And so basically it's like tucking yourself into bed, that sense of being in a burrito or a cocoon. The body often really likes that sensation. Lighting, considering if you can decrease lighting so it's not as harsh, wearing a hat if needed. But again, these are all reactive, right? So I've experienced something that made my nervous system react. I'm going to do something about it in response to that. Not constantly wearing a hat necessarily, because then what we're going to do is get more sensitive to light input, but using that when needed. And then sounds. And the picture in the middle here are Loop earbuds. There's several brands out there. They're not noise canceling, because if we walk around with noise canceling headphones, just like I said with the hat, right, we are going to be very sensitive to sound information over time. We're going to have a different baseline. But these are noise reducing earbuds. So I have a lot of patients who will use these when they go to the grocery store or to the movie theater. If they notice that those loud, really stimulating environments bother them, just minimizing the intensity of the sound, using as needed. Again, it's all about finding balance. So I do want to stress that we don't want to use these things 24/7 or use them all the time, but using them as needed. A body scan is often a helpful strategy to develop better awareness or insight. And John Kabat-Zinn, who's known as the kind of mindfulness meditation guru, he suggests that it's the best thing you can do for pain. And you can find his technique at health.harvard.edu. But there are many others who have different body scans, including Kristen Neff, who I mentioned before. If you have tried a body scan in the past and really didn't like it, especially if you have pain, I highly recommend just giving Kristen Neff's a try. It's a very different approach to a body scan, and it's pretty fantastic. So that's a free resource for you. And again, there's lots of other options online, free or paid. Therapeutic journaling is the process of writing down our thoughts and feelings about our personal experiences. They can be shredded or burned or thrown out. You don't have to be keeping them in a journal if you don't want to. But this allows us to sort through events that have occurred and problems we might be experiencing with, and it might help to regulate our nervous systems. Sometimes things kind of get stuck inside of our bodies, and even if we get them out either through talk or through writing, there's significant research on journaling and therapeutic writing. It differs from more traditional diary type writing, as it's an internal process of expressing your full range of emotions. So unfiltered, just nobody else is going to read it. You probably won't go back and read it again either. Just helping to get that out. And along the way, it can mean writing ourselves to a better emotional and physical health and a greater sense of well-being. The therapeutic writing protocol that was created is listed here, where you write for 4 days in a row for 20 minutes nonstop each day. It's really important that you get to that 20 minutes, as usually there is a lull where you feel like I don't have anything else to say. And what they say is that's when the best stuff comes out. So it's really important to just keep writing, even if it's, I don't know what to write right now, this is getting boring, just keep going. So that 4 days in a row. And the research strongly supports this journaling strategy for pain and chronic illness specifically. Breathing is something that we're probably all familiar with, but breathing is not all created equal. There's lots of different strategies here. And so breath work specifically is the idea of changing, and I like to say just playing with your breath, right? We breathe all day long. Lots of opportunities for us to play with that. There are a few strategies listed here with the focus on extending the exhale even a tiny bit longer if you can compared to your inhale. So making your exhale just a little longer. The reason why is that helps to decrease the heart rate and activate that parasympathetic nervous system. When we inhale, our heart rate goes up, and when we exhale, our heart rate goes down. So if you can, breathe in for 4 seconds and breathe out for 5 or 6 seconds. That's a helpful strategy. And what we want to do is to perform these through our abdomen versus breathing through our chest. So slow, deeper breaths, breathing in through our abdomen, helping to think about your belly as a balloon where you're inflating that balloon. Your belly goes out as you breathe in, and that balloon is letting that air out as your belly comes back. Slower breathing has been shown to help self-regulate, decrease pain perceptions, and reduce our fight or flight response. Some of the other strategies listed there you may have heard of, but square breathing is where you inhale for 4, hold for 4, exhale for 4, and hold for 4. 4-7-8 breathing would be I inhale for 4, hold for 7, exhale for 8. That is typically something that people need to work up toward. So I would not tell you, I do not tell people to go home and just start doing 4-7-8 breathing. It's usually something that you need to work up toward in terms of practicing just more regular breathing with holding your exhale a little bit longer before you get to 4-7-8. But there's a lot of research around that. Okay, tapping is becoming more popular. I've listed a book and app as resources here if you'd like to explore these some more. I'm not going to go through it today, but the basic concept is that you're tapping on specific acupressure points. And the idea is that you're helping to move emotions out of the body. When things get stuck in the body, sometimes that manifests in more pain. The really great thing about tapping is it's accessible anywhere. And so you can use it wherever you are. You don't need any tools but your hands and your body. Some additional strategies for coping include progressive muscle relaxation, incorporating mindfulness into daily activities. So this is even things like when you're eating, trying not to distract yourself with the television, but actually thinking about the food you're eating, where it came from, texture, taste, color, really just being more present in our day-to-day life. Using distraction to turn down that pain signal. So that is different from mindfulness, right? But often needed and helpful. Guided imagery, as I mentioned, there's a lot of guided practices out there. You can do your own imagery practices, thinking about I am, on the beach and really walking yourself through what your favorite place that might be relaxing is. Or there are guided audio options where you can choose, I'm going to go to the forest, or I'm going to go into a really quiet tree and read. Or so if you need that external support, those are very readily available. And then the idea of grounding practices. And so I mentioned that weighted blankets can help, weighted lap pads. But it's really just the concept of noticing the support surface under your body, noticing your connection to that. It could be when you're walking, you notice your foot and the floor supporting you, or outdoors, you can do that barefoot. And you can also just do this sitting in your chair and really noticing that support, helping to connect your body to the world around you. As I mentioned, trauma is not uncommon in pain, whether we know that we've experienced trauma or not. And so there's a lot of options in specially trained professionals who work in this area. EMDR is much more popular now, and it's called eye movement desensitization and reprocessing therapy. So there you can look for a trained professional in that area, as well as somatic experiencing modalities, where you're working to really experience the body's experience of pain, or the body's experience in life, not just our minds. Especially in Western culture, we're very focused on our brain and our minds, and we often ignore or detach from the body. And then, of course, the others that I mentioned in this presentation, like self-compassion work and acceptance commitment therapy, DBT, mindfulness, those kinds of things. Psychology Today is just one resource where you can search by insurance, by location, by zip code, by their specialty. So that's one place that you could find folks nearby, Psychology Today. And then in terms of reframing, so I just like this concept of broken gold objects in Japan. They're often repaired with gold. And so the flaw is seen as actually a unique piece of the object's history, which adds to its beauty. And there's lots of examples of this in other cultures. So just considering when you feel broken, that idea of a shared human experience and uniqueness, and just the other ways that we could reframe those kinds of things. Just a few more slides to go before we wrap up here. Social participation, as an occupational therapist, I'm very much constantly trying to help folks find the right outlet and the right ways to connect with people. We know that socialization is really important. And just as one example, there's a study of older adults with low back pain, and they find that there's less psychological distress in folks with chronic low back pain who have social participation, who have support networks and people around them. And similarly, there's one with college students, a study that was done where they used tools to help folks successfully be able to participate socially using coping strategies, pain management, and different ways to adapt and modify things. So when things feel just so out of reach, recognizing that there's folks out there like occupational therapists and just other resources as well, like psychologists and things like that, that might be able to help you with these components of life, not just looking at sort of the trauma or the background, but really embracing like the day-to-day and how those things can have a profound impact. And similarly, play, right? Leisure activities, hobbies. We don't take play seriously enough is often what occupational therapists will say, because it really helps with coping and managing our illnesses long-term, finding a sense of control over our pain, and a different experience from our sick body, finding purpose and meaning and who we are outside of that. And so we know it releases endorphins, it can create opportunities for distraction, reduce our stress, and often the hard part is knowing what you can do. And so here's just some ideas at the bottom that people who I've seen and just resources online in terms of what folks with experienced pain might be able to enjoy doing. So starting today, try using the word discomfort rather than pain, or I'm feeling a sensation. And then maybe giving that sensation a color, giving that sensation a shape. I know that it feels really silly at first, and I think sometimes folks can get stuck in it feels dismissive. It's not at all to say that what you're experiencing isn't pain, but what we're trying to do is just shift the narrative, minimize the fear, and change those brain signals that we're receiving and that we're sending to our body. And also, rather than saying chronic pain, there's a reason why we try and use the word persistent pain. Just because something is continually happening doesn't mean it's never going to go away. There's no reason to believe that we can't get it to go away, at least to some degree. And so using the word persistent or continual or something like that minimizes that sense of like the chronicity of it. And then thinking about noticing physical sensations rather than on the thoughts that come from the sensations. So rather than if we find ourselves feeling like I'm really sad, I'm frustrated, I'm angry, that this is never gonna stop, but instead thinking, where did that come from? Where did that thought start? Oh, I'm having pain in my knee. How can I describe that in a different way besides pain? We won't have time today for this body scan meditation, but there's lots of resources online. So go ahead and look for one of those. And then just a few more resources for you. Headspace and Calm are both paid apps. Insight Timer, I believe, is still free. Act Coach is an excellent free app that is actually funded by the National Center for PTSD and has some really great resources on there. And then I really can't recommend the Curable app enough. It's not for everyone, but I think it's definitely worth trying. It's 6 weeks. You can get 6 weeks for free, especially if you're seeing a therapist or someone who can connect you with that. But just reach out to us if you would like us to extend that to you. But it's relatively new, and it's a lot of teaching pain neuroscience. And then Mindfulness for Pain. .mindful.org is another resource as a website, and then there's a video called Healing in the Mind, so just some more things to look into. But at this point, I am happy to take questions. Maya, do we have any online?
So thank you so much, Emily, because I think you shared some really important resources for folks, and a lot of different alternatives too to maybe cope with your pain. Is there anything that you can do for yourself mentally? Let's say if you have family or friends who maybe think you're not, maybe you're exaggerating your pain or you're faking the pain, and I'm sure that this must come up quite often where people don't believe, like, are you having that persistent pain? Is there any ideas at all that somebody, just how they can handle that piece?
Yeah, this is just so common, and usually it comes from a well-intentioned place from loved ones, right? Of really having trouble with seeing their family member, friend experience this. But I think A is education. Trying to bring those people to appointments if they will come with you. Um, Finding a therapist who really understands this and can support you, as well as hopefully extend that understanding to your family member. So obviously, my hope is that we can get that person on board, get them to understand, and then I can also appreciate how that is not the case for a lot of people. There are a lot of humans in this world who just are not going to understand that experience, and so at that point, it's much more focusing on you and your own acceptance of recognizing this person's just not going to understand it. So that's when I think, yeah, really working with a therapist one-on-one to help um, yeah, your own processing of how to work through the challenges that this person's not, understanding this, that they're invalidating perhaps, and then knowing how to act on that, right? So what do I do in response when they have these reactions to my pain or to what I have to set boundaries? And so, boundary setting, explaining, like, I don't have the energy to explain this to you. You don't have to understand, you just need to respect, or, those kinds of things, helping them to know what's helpful versus what is just not helpful for you. I've heard you say this before, I've explored this, whatever it is. So I think their hearts are in the right place when they say different things, but it often doesn't come out that way, and can be really unproductive. So.
Sure. Yeah. And I do think the education piece is huge. And what you said there, sometimes people just don't understand, and didn't realize. And so that's important too, that they might not just realize exactly,
Right.
type of pain that you're in. And so sometimes maybe helping to explain that a little more. Can you tell us a little bit just about, I know you're over at our adult outpatient therapy. So if somebody would like to see, a therapist there, what would that process be?
Yeah, so at outpatient therapy here at TMC, we have speech therapy, physical therapy, and occupational therapy, which is myself. And so we work as an interdisciplinary team. So if you need to see someone more, if you're looking for exercise, if you're looking for a specific body part that's really causing issue, then a physical therapist is often more appropriate. If you're looking for lifestyle interventions and modifying your workstation or understanding how to incorporate all of what I just talked about into your day-to-day life, like how do I do this when I'm in pain all day? That might be more of an occupational therapist sort of a thing. So what you would do is just go to your medical provider. It can be a physician, nurse practitioner, whoever you see in whatever specialty or primary care. They just need to send a referral to TMC Outpatient Therapy, and then you would just schedule and come in to see us. So
Great. And I did just put the phone number up as well. It's 520-324-7005 for anyone who may be interested in learning more information. But I know a referral is always required to be seen. It's a great facility over there, and you guys do an amazing job with so many different aspects of, whether it's your PT, your OT, your speech, audiology. So it's really amazing. So I appreciate you being here today, Emily, and I'm going to send it back over to the room so you can answer any questions there. But thank you so much for being here today.
thank you, Maya.
So we are finishing up with our chronic pain series in January, so you'll be able to hear more at that time. If you are interested, our next presentation is actually going to be next week. It is, what is your epigenetic age and what does it mean? We'll have that on Wednesday, December 7th at 2 p.m. Please give us a call at 520-324-1960 if you are interested in signing up for that class. We hope you have a great afternoon, and we'll see you next time. Thanks.